A cholera outbreak is spreading quickly across Sudan's capital, Khartoum. In the past 3 days, the health ministry has recorded dozens of deaths, with more than 8,500 suspected cases reported across Khartoum state alone. Health officials are warning the country stands on the brink of a public health catastrophe.
We have been assessing the pandemic situation in Khartoum as more cholera cases were rapidly reported over the past week. Close daily monitoring proved clearly that the number of cases is increasingly growing, from 100 cases per day up to 1,000 as of today. This is a proven pandemic infection, which requires swift and firm intervention on all fronts.
The crisis has been made worse by Sudan's conflict, now in its third year. Drone attacks have targeted water purification stations. People have no choice but to use contaminated water sources. Power outages have added to the problem, and healthcare facilities are struggling to cope with the surge in patients. Doctors Without Borders says many health workers have been forced to flee, leaving the few remaining facilities overwhelmed.
My brother passed away and his son also died in Omdurman due to a cholera infection. Thank God we acted quickly. They immediately began the disinfection process. Because we responded promptly and took swift action, the outcomes were much better.
And the situation has worsened since the return of thousands of internally displaced people to Khartoum, after the Sudanese army drove out the paramilitary RSF fighters from the capital in March. While many welcomed the relative calm, the mass movement of people threatens to accelerate the outbreak.
We were under siege, and we also suffered from power outages and a lack of water. We had to rely on seawater. Although I took all the necessary precautions to protect myself and my children, there was nothing more I could do, and in the end, I got sick.
Cholera is a preventable and treatable waterborne disease, but it can be fatal if left untreated. Aid agencies have delivered medical supplies to some hospitals, but they say far more resources are urgently needed. With cases now reported beyond Khartoum in northern and southern Sudan, officials are working to contain an outbreak that threatens to overwhelm an already devastated healthcare system. Aksel, Zaimovic, Al Jazeera.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.